Hi, I'm Sarah. I'm a physical therapy student at the University of Central Florida, and today I'm going to be doing a brief evaluation of my patient's posture. So right now I have him standing in a neutral position for him, feet shoulder width apart with shoes off. And so I'm going to stand to the side and just observe his basic spinal curve. So I am seeing that he's holding his head in a neutral position, and he has a normal lordotic curve of his cervical spine. As I'm looking down his thoracic spine, I'm seeing that he has a slight excessive kyphosis of the thoracic spine, and then when we get into the lumbar spine, it comes back to the normal lordosis. I don't think it's excessive. And if I simply observe him from the back, I can see that his left shoulder is slightly higher than his right shoulder. So the first measurement I'm going to be doing is to assess his trunk flexion. So I'm going to take a tape measure and I'm going to palpate and find C7, and also palpate coming in from PSIS into S2. And so those are my two landmark measurements. And so I'm going to start at C7, and I'm going to let the tape measure follow the curve of the back. And I get a measurement of 51 centimeters. And then can you go ahead and bend forward? Your hands can follow the front of your legs and bend down as far as comfortable. You can have a slight bend in your knee. And again, I'm going to start at C7 and follow down and find S2. And now I'm getting a measure of 59 centimeters. And so I'm going to subtract the two measurements. You can go ahead and stand up. And I get a difference of 9 centimeters. Normal would be about 10 centimeters. So I don't think he's very restricted in his flexion. The next measurement that I'm going to be doing is to assess his lateral flexion. I'm going to use two inclinometers. So the first inclinometer is going to be at T1. So I'm going to find C7, go just distally, and make sure that I have my inclinometer zeroed. And then I'm going to place the other inclinometer S2. And again, make sure that it's zeroed. And then go ahead and lean to your right with keeping your right hand by your right leg as far as is comfortable. And my top inclinometer is measuring 50 degrees and my bottom is measuring 8 degrees, so he has a measurement of 42 degrees. And normal expected would be about 25 degrees, so he has a little bit an excessive amount of lateral flexion. Now I'm going to be doing two muscle tests. The first one is going to be trunk flexion, so go ahead and lay on your back in the bed. And so the first measurement, his legs are going to be extended. I want you to keep your arms by your side, and I want you to sit up, bending your lower back, and I'm going to look to see that he's cleared his inferior angles, which he has. So he would get a 3 out of 5 grade. Now I want you to cross your hands over your chest and go ahead and sit up for me. And again, he's able to clear the inferior angle of the scapula, so go ahead and lay back down. And so that would get him a 4, and go ahead and put your arms behind your head and sit up. And again, he can clear the inferior angle, so he gets a score of 5 out of 5. Next, we're going to assess his trunk extension strength. So I'm going to put a pillow under his pelvis so that he doesn't have any tilting. And I'm going to take a belt and I'm going to strap the belt over his pelvis to stabilize and pull it tight. And so the first measure we're going to do is I'm going to have this place his hands behind his back and have him lean up like he's looking at the wall, and he can clear his xiphoid process, so that would earn him a score of 4 out of 5. And then go ahead and place your arms behind your head and then sit up and look at the wall. And again, I can feel that he is clearing his xiphoid process, and so that would earn him a score of 5 out of 5 points. And for extension, we're testing muscles like the erector spinae or your primary trunk extensor muscles, and when we were doing the flexion test, we were primarily testing the rectus abdominis and both your oblique muscles.